Back in the studio now talking about something that some of you might be familiar with. I think sometimes they get a bad rap, but Dr. Doug Yateman from aascend Pain Institute is here to set the record straight on epidurals. Good morning. Good to see you.
Thanks for having me.
Thanks for being here. I think that people are a little scared of epidurals. I think most people think of an epidural when it comes to, labor and delivery, and I think that, there's a lot of myths associated with them. So what are they, for one thing?
Well, the myths are that it's very dangerous and that it will cause deaths. There's been over about 8 million a year performed. Last year was a bad year because they had an infection with a fungus that tainted drugs. They had 53 deaths. So 8 million and 53 deaths, and we know what caused that one. But normally there's very few deaths throughout, and it's been going on for over 70 years.
So that was kind of a freak thing, and that problem is taken care of. And it didn't really have anything to do with the procedure. It had to do with more the medicine, right?
It was the medicine, yes.
Okay.
The medicine caused the meningitis. It's a weird meningitis, fungal meningitis, which no one really seen before. It's not normal looking meningitis. But the procedure itself, mostly for leg pain, shooting pain, irritated nerves, or people who have spinal stenosis, who walk and the legs get very heavy, have to sit down for a few minutes and go again. What it does, it calms the irritation down, sort of heals your inflamed nerves. Is it perfect? No. But I used to tell people it pushes off surgery down the road. Some people just need one a year, one every couple of years. A few people, it kind of gives you an idea, yeah, you need surgery. So that's what we sort of go for. But you have to fail physical therapy, chiropractic therapy, regular acupuncture, conservative stuff first, then medications, and then you go on.
So it kind of, does it, kind of numb certain areas, or how does it work? And show us what,
Okay, so what it is, an epidural, is epi, means around, the dura. The sac is what your spine floats in. So all we're doing is putting medicine around the sac where the nerves. So like this little model we have where the disc is bulged out and it's coming near the nerve, right through here. This nerve would be irritated. So there's two ways to do it. You can actually put it right here where the nerve is, or you put it across the back side, and we actually inject it into the whole column, sort of flood the whole area. And what that does, the medicine, I put in two medicines, local anesthetic and steroid. Local anesthetic numbs it, makes pain go away, we're in the right spot. The second medicine is a steroid, that's what makes things last long term. It helps speed up healing and calms things down.
Okay, all right. So, and then this is just another way to, show that? Is that what?
Yep, this is your lower lumbar spine.
Okay.
So you have some pretty good spots to get into.
So I see that, yeah.
I was trained to do it what we call blind without x-ray. And like I said, labor and delivery, the moving target was kind of fun because people don't sit too still. But now we use fluoroscope, we use x-ray. So it's like a video game. So that's what you look for. You want someone who's fellowship trained, spent a lot of time training these. I teach these to other doctors too. So you want someone who's been fellowship trained, spent a lot of time in training, and they will do an exam. If they say, let's do an epidural, well, make sure you fail the physical therapy, the conservative stuff first, and then it progresses on.
Can you do this outpatient? They'll just come to the office and do this?
Correct.
Okay.
It's quick, in and out.
And then, results, like you say, it can last for up to a year?
Yes. What it does, it demonstrates where the pain is. The MRI shows it. Sort of, okay, yeah, this works well. I tell patients, push the surgery off. Now, everyone's saying, well, we had those 50-some deaths last year. If you look at the statistics, well, let's do medications. Narcotics at 150,000 deaths last year versus 53.
Right.
So I'm kind of like 8 million versus, with 53 deaths versus 150,000 deaths. I'm kind of leaning toward this one better.
Yeah, I guess.
Much safer.
I understand why. If you have any sort of aching pain, a pain that's just been with you and you just can't seem to get rid of it, and you're just, at a loss, and you think, maybe I have to live with it, you might not have to. So that's what Doug and his team do. aascend Pain Institute. Doug Yateman, always great to see you. Thanks so much.
Thanks.